All right, fam. So these are the common complaints when you're dealing with metabolic dysfunction and metabolic syndrome. We have chronic fatigue. We have just feeling tired. We also have daytime sleepiness. Sometimes that can come with what's called obstructive sleep apnea. You have brain fog, decreased concentration. And then you have some symptoms that are more related to hyperglycemia. So increased thirst, increased urination during the daytime or at nighttime. You have increased sugar cravings, blurred vision, and we also can get weight gain. And symptoms of PCOS as well, which is irregular menses and hirsutism. And then you can also have some complaints about unable to conceive. So here are also some physical exam findings or signs or symptoms related to metabolic dysfunction, metabolic syndrome. We have increased body fat or increased visceral fat, skin changes, you get skin tags, you can get these dark patches. A lot of times it's behind the neck or in some of the folds, which is called acanthosis nigricans. And also if you're doing, your vital signs, you can see increase in blood pressure. And also on exam find, you can also see some hepatomegaly, which is enlarged liver. So these are some laboratory findings that can hint at metabolic dysfunction, but also can also diagnose and be a part of a diagnosis of metabolic syndrome. So you have increased triglycerides, which can be greater or equal than 150. I left out the units. Most of the time, you don't really have to worry about that. Your lab or whatever medical facility you go to should have that calibrated. Decreased HDL, which in males typically is less than 40. In females, it's less than 50. Increased fasting blood sugar, generally greater than 100. Increased blood pressure, so that's greater or equal to 130/85. This is part of the criteria of metabolic syndrome. Now, in terms of other findings you can get increase in LFTs, which is your liver function test. Specifically, there's ALT, AST, and GGT. And then if you're worried about some inflammatory markers that might be elevated, which is really common, right? In terms of that's one of the functions of metabolic dysfunction, metabolic syndrome. You can get increase in CRP, and then you can get increase in interleukin 6 and then TNF alpha. Now, in terms of for your general lab, you can get a CRP done, but most people don't test these. You might have to go to a functional medicine clinic or find a facility that actually does those testings. If you're kind of also worried about insulin resistance, which as you guys know is also another hallmark of metabolic health and metabolic dysfunction, metabolic syndrome, you can get a C-peptide. Some people always talk about insulin as a marker and how do you screen for that. Some people prefer insulin. You look at the information data, the C-peptide is a function of the beta cell of the pancreas. Now, whenever there's an increase in insulin resistance, you actually will see the C-peptide increase. Now, why is the C-peptide more superior? I think in terms of accurate diagnosing insulin resistance, because this actually gets absorbed in the liver versus this one does not. So you can accurately test what the C-peptide is, and this one obviously does get absorbed to the liver, so not as accurate. That's why most clinicians don't check for insulin. Most time we check for a C-peptide, which is a more accurate test for the resistance, but also the function of your beta cell, which is producing your insulin. Now, at some point when insulin gets so resistant and you become insulin dependent, or what happened when C-peptide gets basically depleted and you actually get a decline in C-peptide, which actually becomes less than 1, then unfortunately you will have to be on insulin or something like insulin to kind of make sure we get the sugar out of the bloodstream and get you the support you need. So hopefully that helps. And also too, if you're getting some imaging done, it might not directly be related to about what's going on, but sometimes it can be imaging done for chest discomfort, or you notice that there is some elevated fatty liver disease and you get the increase in the liver enzyme. So these are some of the imaging findings that you can kind of see. So fatty liver, you can see, you'll see hepatic steatosis, where on the description it will actually say there's fatty streaks and those type of things that might hint at more fatty liver disease. You can also see increase in visceral adipose tissue, which is VAT. That's basically just the visceral fat. And then you could also see arterial calcification or coronary artery disease. So that comes up sometimes when, say, you have an image done for a CT scan or an X-ray, and it'll see coronary artery disease or calcifications within the coronary arteries. You can always see that's in the aorta. Sometimes you get atherosclerosis, that you can see that as well too. So just kind of be on the lookout for that. Talk to your clinician. Sometimes we can do advanced studies like calcium score or calcium scan. Those things can be very helpful to really determine exactly what is the physical markings of metabolic health and if it's going in the wrong direction. Hey, I also have a website that you can click on. So on the link below, just click there. You can get more information about me in general, but also about some helpful insights and tricks. You can also sign up for my newsletter. It's free once a week. And there'll be other helpful tips on there as well. So go ahead and visit the links below. Talk to you soon. Back to the video. All right, fam, I'm going to show you how someone progresses from metabolically healthy to metabolic dysfunction to metabolic syndrome and then to chronic diseases. Follow me here. So you have a metabolically healthy individual that's doing all the right things, right? Lifestyle and all that good stuff, eating right, exercising, sleeping, you name it. And then you start getting issue with hyperglycemia or any kind of chronic inflammation. You get this concern here. So insulin resistance, chronic inflammation, and then you get progressive to metabolic dysfunction where you start kind of causing havoc on your energy factory, which is your mitochondria. You can get mitochondrial dysfunction. Then you develop oxidative stress where you start now releasing these free radicals. And you get lipotoxicity, which obviously you get fat into places it shouldn't be. And then you can develop it to metabolic syndrome. And just remember, you're supposed to satisfy 3 of the 5 the criteria now listed here. So you have increased waist circumference, increase in triglycerides, increase in blood pressure, decrease in HDL, and then increase in fasting blood sugar levels, right? Fasting blood glucose. And then you develop into chronic diseases. So you had diabetes, hypertension, dyslipidemia, you get heart disease, fatty liver disease, infertility, and you can also develop it to cancer. There's been a lot of research on how metabolic dysfunction syndrome, also can also predispose you into cancer. So just kind of walked in this pathway. At the end of it, we're trying to stay metabolically healthy as possible. And the good news is with the right system, the right tools, we can revert this and get to metabolically healthy. So hopefully that helps. I hope that gets you some motivation to get healthy and, live right. Talk to you soon. Bye.